Hey everyone, how's it going? My name is Jeff and I'm an occupational therapist who works in the hospital, often with patients who have had a stroke. And today I'm going to go over what I consider to be a pretty fundamental skill, and that's how to do bed mobility. More specifically, how to go from laying like flat on your back in bed to sitting up at the head of bed. And that's a pretty important and useful kind of position to go into, sitting up at the head of bed for things like eating, brushing your teeth, brushing your hair, watching a TV show, and many, many more. Now, typically how people often sit up in the head of bed without a stroke is they probably kind of go into like a sit-up position, and they start off like this, and then they kind of scoot themselves back. In order for me to even sit up, it takes a considerable amount of effort to even come into a sit position. Now, if you want to try this, then that's a really great rehab thing to try, as it promotes and facilitates use of your whole body, especially your core and your stroke affected side. I'm going to show you this way just so there's two methods to do it, and I'll go over and focus more on the easier of the ways so that everyone can do it. So with the typical method that people more intuitively try to do it is they probably want to go into a sit-up position. And to do that, you don't want your leg to be in your way. So you don't want it to be bent or anything like that. So the best way is to have your legs just flat on the bed, I've come to find. And then from here, what you can try to do is use your strong side to kind of push yourself up into a sit. Now, if you have some considerable use of your stroke side, then you can try to use that. And I encourage you to use that as well as kind of a pusher and helper. So if you can have it onto the side and try and do a little bit of work and pushing. Even if it's just your elbow, that's still better than nothing. So I'm going to be pushing with my right elbow on my stroke side. And from here, I'm going to use my left arm and try and use both sides of my core, all of my muscles in my trunk and my abdomen, if I can. And it's going to take maybe even several pushes. And the thing about this position is it may be hard for most people to hold, and they may fall back down. So this is actually a pretty good position to practice your core and to holding yourself and sitting up. At the very least, even if you don't get anywhere, putting weight through your right elbow is a good rehabilitative technique and practice, so to speak, to promote recovery in your stroke side. Now, if you have, of course, stroke affecting your other side, then the same applies. It's just I'm demonstrating for the right-sided stroke just so it's easier to see on camera, basically because I have a wall on this side. And then the next step intuitively, you would probably want to use your leg to help scoot yourself back, probably even use your arms to help scoot, right? But you can see how it's kind of awkward, and what people tend to do when they kind of push like this is they may fall back down. If you have really good trunk control and you can sit yourself up pretty good like this, then yes, I encourage you to do some scoots as much as you can with your whole body to get yourself all the way up to the headboard. And I feel it basically the pillow at the back against my lower back. So from here, I know I'm pretty close, and I can just slowly lean back into my headboard, and I'm in that sitting up position at the head of bed. As you can tell, it took a considerable amount of effort. So this is the first technique that you should try, but of course, make sure that you guys are all safe while you're doing it and not doing it, say, at like the very edge of the bed. I don't want anybody falling and getting injured as they're doing this. At the very least, I highly recommend that you have a spotter or helper nearby to especially help you if you get stuck and you end up in an awkward position. What do they call it? Cattywampus. Technique number 2, which I find way easier and which allows everybody to do it, is to basically go onto your side. Now, it's not very intuitive, but going on your side is actually a pretty good practice. Those of you who have seen my getting out of bed video for, say, sitting balance have seen and probably practiced sitting on the edge of the bed by going onto the side of the bed. So now I'm on my back, and basically I have two sides that I can roll onto, right? Now, I've talked about in other videos, this really depends on your setup and what your environment is like. And I think it's personally good to practice going on both sides in both directions because it's just good practice. And you never know when you may need to use that skill of going on to the opposite side that you're not used to. Rolling onto your non-stroke side is going to be easier. So in my case, this would be my left side, away from the camera. And the reason being is all my force and effort can be used against the bed, and I can use myself to scoot up higher towards the headboard. Versus rolling onto my weaker side, all my effort is still going to come from my left stronger side. Even though I'm going to try and use both sides of my body, most of the work is going to be coming like above my body, so to speak. So I won't be able to go as much or further as I was to go to the opposite side. So if you have the ability, I highly recommend that you start rolling onto your non-stroke side first. So in my instance, it'll be going on to this side to at least get a feel for what it's like to do this. So now I'm going to roll onto my stronger side and show you how much easier it is going onto my stronger side. And one way I can do that is I can kind of use the headboard or the edge of the bed to kind of pull towards, using that as leverage, and I'm going to simultaneously turn my entire body. Okay. That was probably the hardest part out of the entire process, turning onto your strong side and having your stroke side on top. But from here you can see that it's much easier. So now I can do the same thing. I can even do this kind of scooping method and go same kind of posture. I'm side-lying, and then I can kick much easier. See how much faster I can do that too? And then from here, once I kind of get to the position that I really want to, I can't go any further, I'll be off camera. And then I can just roll onto my back and then sit up that way.